Yep.
Okay, are you ready for these next group of exercises now?
Sure, I'm dripping.
Okay, so he's nice and warmed
That's
up,
normal.
which is really nice. Good, he's a good sweater, and that's a gift to be able to sweat
Yeah.
well and get rid of toxins, that's for sure. Now, we just spent the last 20 minutes doing flexion exercises for the lumbosacral area, and also it included the full spine. It went all the way up to the neck and through the whole body of this group of exercises, emphasizing flexion. We also did some extension by doing the pelvic lifts, which were these things here. Can you see me in the film there? Okay.
Yep.
Yeah. So we did pelvic lifts, which is a form of extension at the low back, but we mostly did flexion exercises, which was forward like this, in a lying position. The next group of exercises are called the Sunset Six. We're going to be in a prone position, so Sean, if you could roll over onto your stomach. And we're going to do these carefully with him because he, oh my God, you are really sweating, aren't you? Okay. We'll try to keep your face out of it, right? Just come down further when you can. There you go, okay. So the Sunset Six is all about extension of the spine, and we need both movements. Primary movement is flexion. Another primary movement is extension, but we seem to do a lot less extension in our lives than we do flexion. But this is going to help you to get the spine to bend both directions, which constitutes a healthy spine. Come down now onto your hands here. Put one hand down and a fist on your hand, and then put your chin on your fist. And just relax. Take a nice deep breath of air in and rock your butt back and forth. And just try to relax your low back. And think of the lumbar spine just sinking into the floor here like the old gray mare. Have you ever seen an old gray mare?
No.
No. Well, after a mare has had so many babies, she has a nice, lumbar spine that's just sunk down almost, her belly's on the ground. So, okay, so that's what it looks like.
I have seen an old gray.
Yeah, I've seen an old gray mare, right on, okay. So just rock and breathe into your lower stomach and totally relax your glutes, your low back, and just imagine the old gray mare and the swaying back. You want your belly button to come down and touch the floor. Breath in, breathe out. So visualize instead of your belly button, your low back, your actual low back spine coming down and touching the floor in front of you. Okay, so that's good. You feel relaxed now?
Mm-hmm.
Now we're going to stretch the most wicked muscle in your body right now, which is the hip flexor and the quadratus lumbar, actually the psoas and the rectus femoris. So I want you to reach back, Sean, and grab your foot on your right foot. Can you reach back with your right hand and grab it? Are you okay with that?
Mm-hmm.
Okay, support yourself with your left hand and put your head down now. Are you okay with that?
Yes.
Okay, now he's able to stretch the rectus femoris right here and not cheat. Because if you try to stretch this muscle when you're standing up, usually people flex at the hip instead of getting a good stretch. So this is perfect. Take a breath in, and as you breathe out, gently pull it a little further to your butt. That is perfect. You got a perfect stretch. Breathe in, let it up a little bit. Breathe out, pull it too. Stretch, nice stretch. We'll do it 3 times. Breath in, let it up. As you breathe out, as you exhale, stretch it. Is that getting easier as you go?
Yeah, it is.
It's really nice because at first it's really, really tight, and then you just ease into it and let it relax. Okay, let off, and we're going to change legs. And sometimes one side is more tight than the other. You got a hold of it? Okay. And if you have to rotate your body up to the left to get the foot, then go ahead. And sometimes you'll need a friend to help you to do this stretch, but it's very important. It's probably one of the most important stretches to get out of low back pain. And it is a huge postural muscle, which we're going to get to in the future, teaching you the postural films, the postural exercises. Breath in, breathe out, and hold. That's beautiful. Is that the 3rd time?
Second.
Okay. Breathe in one more time. And out and stretch. I'm going to recommend that you repeat that 2 times. You could possibly stop the film if you're watching right now and just repeat it to get on the right and left. But we're going to go to the next exercise. Okay, go ahead and release that, Sean. And now put your chin back onto your fist again. So there you go. And rock again and breathe in deep, way deep into your lower stomach. Like you're lifting your stomach up off the ground and your whole body's lifting up and you take a breath in. And then breathe out and let it relax. It feels so good, doesn't it? Just feels so good.
It does.
Okay, the next exercise is the prone cross crawl. Now, normally we do the prone cross crawl with the arms overhead. Can you do the prone cross crawl with your arms overhead without hurting your back? Let's see what
I
happens.
think so.
If this hurts your back, then you'll be putting your arms down by your sides to do the prone cross crawl. What I'll do is I'll do it with the arms at my sides. Are you okay with them overhead?
Okay.
Okay. You know what, let's do this though, let's
Yeah.
do it right. You put your arms down by your sides and rotate your head this way. And then he won't hurt his back. I'm gonna demonstrate with the arms overhead because I don't have a back problem right now, okay? So, lift your right arm up, behind you and up. There you go, and your left leg. Your left leg. There you go. That's the cross pattern. Dorsiflex your toe, there you go. So breathe out. Now breathe in and let it down. Breathe out, come up with your left arm and your right leg. 2. That's beautiful, and make sure your toes dorsiflex. Breath out. Excuse me, breath out. Now breathe in, come down. Breathe out, come up with the right arm and the left leg. 2, 3, 4, 5. Breath in, keep going. Breath out. The knees nice and straight. I don't want any rotation, just straight up from the hip. That's excellent, just a nice little arc. Breath in, come down. Breath out, come up. Beautiful. Is there any back pain with this?
No.
Beautiful. Breath in now. Breath out, come up again. Dorsiflex the toe. He's got good extension. His hip flexors are restricting him a little bit, but that will soon wane as soon as he does this for about a week. Breath in, breath out. That's beautiful. Prone cross crawl. Let her down. Again, return to the chin on fist position. Take a nice deep breath of air in and rock your butt. We call it rock your booty. Breath in and breath out. There's some kind of a song like that, isn't there? Rock your booty? Or, no, it's shake your booty. Is it shake your booty?
Mm-hmm. Shake, shake, shake your booty.
That's it. Okay, we're going to shake our booty here and breathe in. Okay, now this is going to progress into the child's pose, which you come up on your hands and knees. Lock your knees in, and I want you to get onto your elbows. Now we're going to do a different version of the child's pose. Just get on your elbows. There you go. And come forward a little bit so your knees are straight up and down on the mat. You see how I'm straight up and down?
Yeah.
Walk your legs, your arms forward a little bit more.
Like cut and, okay.
There we go.
Okay, so.
Ground zero, walk in.
You're on your elbows there. That's good. So walk them further forward just a little bit. Not your knees, your elbows. Come back with your knees. A little more. There you go. Now, you're gonna take a deep breath of air and then come forward. Breathe in and come forward. Breathe in. Strengthening and tightening here. Now breathe out and come back. Your toes are touching, your knees are out a little bit further. A little further out. There you go, so you don't hurt your knees. And come down and let your head rest. And now we're in an ultimate lumbosacral stretch here. The discs are able just to relax, go forward, go anteriorly, and the areas of subluxation are now starting to relax and the muscle tightness. You breathe in, come forward, and come back and stretch it again. So he's getting a really nice movement, lumbosacral flexion and extension there. And I want to do that one more time. Breath in, come forward. Hold it there, and come back and stretch on the heels. Is it comfortable?
Yeah, feels good.
Excellent. And just let the head relax now. This is like if your back hurts you, at any time, this is a really great stretch to do. Even if you're at work and you can get down to this position and you're hurting, then you can go ahead and do this. It'll be very helpful. Very good. Okay. Now we're going to come up onto our hands and knees again. And we're going to stretch down the Achilles tendons. So you're going to come up, see if you can do this right now. I don't know if you're capable, but come up and see if you can go into the down dog position, stretching your Achilles tendons. Excellent. Is that okay?
Mm-hmm.
Perfect. Take a nice deep breath of air in and start moving your feet back and forth, stretching the Achilles tendons alternately. So it's like where you're pumping your toes like this, Sean, like this. That's good. Just like you're pumping a bicycle or on the edge of a curb. You've created your own curve here to get this nice, excellent Achilles stretch. All these muscles contribute to the tightness of your spine, so we cannot leave any major muscle groups out when it comes to stretching for low back stabilization. Okay, that's excellent. Now come down onto your knees. Okay, then you're going to come back up. You could, in this posture too, you could do a cat-cow, which would be excellent for this. Is that hurting you at all now?
No.
So you're basically out of pain now.
Okay. Yeah,
Yeah.
I feel good.
This is awesome. So he
You got
comes
my
in
blood
and-
flowing.
Exactly. That too, the whole spine has gotten a good exercise. You've done lots of flexion, extension all the way up your spine. Now we have one more exercise to do that I think we need to stretch the psoas muscle now, which is right here in your groin.
Okay.
And that's part of what your radicular pain was this when you came in a little while ago. So the pain to the psoas here was coming from the L4, but is also being squeezed by the psoas, the nerve, the inguinal nerve that comes through here. So you're going to go ahead and put your left leg forward and hands on your knees. Take a deep breath of air in and kind of come up. Straighten your leg a little bit. And then breathe out and come forward and stretch that right psoas. You're upright, your chest is up and nice, it looks really good. Breathe in, come back. Exhale, come into the stretch. That's perfect. Breathe in. The third time. I always love 3. 3's a charm. Breathe out. 2, 3, 4, 5. That's good. Now come back and we'll switch legs. And put the right leg forward. And now we are effectively going to stretch the left psoas. Breath in, breath out, come forward. And that's good, breath in. It seems that we've learned now in a little bit more recent physiological studies that we don't have to stretch for like 20, 30, 40 seconds. An effective stretch is anywhere from 6 to 10 seconds is a very effective stretch. One more time, breath in. And breath out. Nice, beautiful, flowing, terminal stretch. You okay? Okay, breath in, come up. That's beautiful. That is the basics of the Sunset 6 extension exercises. And you do that through this weekend. You keep doing the Sunrise 7, Sunset 6 about 2 to 3 times a day. And I can guarantee you at this point, because of the results that we've gotten here today, that you'll probably be well within a couple of weeks of this disc issue. So, and we know that it's a disc because of the radicular pattern. You had 3 distinctive problems, which you thought you had a groin strain, you thought you might have had a hernia, possibly a hernia. You thought you might have had and some kind of rectal problem.
My prostate.
Yeah.
I was like, I'm
Yeah.
too young.
Exactly. And then there was an erectile problem too. So that was all taken care of. Well, I don't know about the erectile problem, but I think that it's
Well,
probably
it was painful.
okay.
It was painful, so yeah. I mean,
Okay, all right.
yeah.
So that should be okay. And if you do hurt and if there's any problem with function in those areas, just lay down, get on the ice pack and do the Sunrise 7 and Sunset 6 again. I think you're set.
Okay,
Okay?
thank you.
Yeah, thank you for coming and thanks for being a part of this.